So steroid use in the emergency room can be controversial. There are some times in which it's really not controversial. Known immune-mediated disease processes is kind of the classic use of steroids. So animals who present to us and are diagnosed with immune-mediated thrombocytopenia, immune-mediated hemolytic anemia, immune-mediated polyarthritis, those animals require steroids most of the time, at least in the beginning, in order to get their immune-mediated disease under control. Certainly also we use steroids in animals with Addisonian crisis, so as replacement for animals with Addison's disease, as well as to help support blood glucose in animals with insulinoma. Also many times sterile disease processes, sterile inflammatory disease processes like meningoencephalitis of unknown etiology, also known as granulomatous meningoencephalitis in dogs, steroid responsive meningitis and things like that. Most of those disease processes require pretty rigorous diagnostic testing, so it's uncommon that we're using steroids for those indications in the emergency room. But certainly if an animal with that known problem were to come in having an exacerbation of clinical signs, steroids would be indicated then. After full staging and diagnosis and full staging of hematopoietic neoplasias, so lymphoma, mast cell disease, and other similar problems, steroids are often a cornerstone of management of those disease processes, but it is important to remember that you have to fully stage them out. You have to be sure you have your diagnosis, and any diagnostic test you want done before you start steroids, it has to be done. Because once we start steroids, those disease processes can be very, very difficult to diagnose. So you hide your own diagnosis. So you got to get all your ducks in a row before you start. There are some other indications as well, for instance, treatment of hypercalcemia and such. They're a bit less common, but they're not controversial.